Hello, hello. I'm Sosa. It is Marfan Syndrome Awareness Month, and I was approached and asked if I wouldn't mind sharing my story for Marfan Syndrome Awareness Month. Of course, I said, of course, I'd love to share my story any way I can help. Um, More than happy to do so. Um, this is my first time making a video of this sort, and I'm laughing because I've already made this video, except that my laptop decided it was not going to record any sound the entire video. So here we go again. We're going to give this another shot and see if we can actually get all the way through this. I ask that you bear with me if you hear paper rustling in the background. That's just me looking at my notes. There's just so many things and so many timelines that I want to try to remember that I'm just not going to remember off the top of my head. So we're going to give this a whirl. Let's start off by talking about what Marfan syndrome is. So Marfan syndrome is a genetic connective tissue disorder. It affects about 1 in every 5,000 people. And 3 out of 4 people with Marfan syndrome inherit the condition. That means that the other percentage experience it through spontaneous mutation, which means that no one else in their family has it, and they're the first ones to be diagnosed with Marfan syndrome. But for the most part, it is inherited through family members, usually parents. So I have Marfan syndrome, and I was clinically diagnosed as a child, but just a few years ago was actually genetically diagnosed as confirmation. So my story starts as a baby. Of course, I was born with Marfan syndrome. You have to be born with it. And my mother had to have a C-section to deliver me. I was born with collapsed lungs, and I was in an incubator for a while, and I had IVs going in and out of many places. And my mom describes the event, or I guess her first time meeting me, as I was very multicolored. And so I assume that's from lack of oxygen and maybe bruising from the IVs and whatnot. So that's my start to the world. We pretty much went forward throughout the first couple years of my life with no events, essentially. And then when I was 3 years old, my mom noticed that I was walking into walls and bumping into a lot of things. And mind you, I'm a pretty clumsy person anyway, but I think that she was very concerned about visual impairments, which she was right. So she took me to the ophthalmologist, and after an opto exam, they discovered that I had dislocated lenses in my eyes. So couple that with the fact that I had long appendages and long fingers, and also my family history, because my father passed away at 29 with an aortic rupture without any background of any obvious illness or anything like that. So they gathered all that information, and they clinically diagnosed me in the ophthalmology office as Marfan syndrome. And the ophthalmologist recommended that I be referred to a cardiologist at that time just to begin follow-up care. So there began our little journey of, back and forth hospital visits and whatnot. So we got set up with a cardiologist, and everything seemed to be within normal range at that point. And so the decision was made to just maintain on a follow-up type schedule. So went on throughout my childhood, like I said, for another couple years, until I was about 5 and 6 years old. I developed inguinal hernias, and Marfan's syndrome, like I said, affects connective tissue. And so connective tissue is all throughout your body. And so that includes bones and ligaments and skin and your lungs and, of course, your blood vessels, um, even your eyes, and those kind of things. And so um, my connective tissue in my abdominal wall was very weak, and I developed inguinal hernias. I had three inguinal hernia repairs between the ages of 5 and 6. Two of them were at the same time, and then the other one was to follow. So that was the first experience I had with surgery. And this is going to sound a little strange, but I actually liked being in the hospital because you'd get visitors and candy and balloons and presents, and the doctors and the nurses, treated you very well. So I loved it. I mean, I figured, well, there's a little bit of pain and whatnot, but look at all the attention I'm getting. Kids love attention. So that says nothing about my personality. Anyway, so then we healed up nicely from that. We continued on about our lives again. And when I was about 8 years old, apparently the winter of that year, I was complaining about chest pain that was radiating down into my abdomen and shortness of breath. And apparently it only got better when I was at rest. So another visit to the cardiologist, and they discovered that I had a 3 by 4 centimeter atrial septal defect in my heart, which essentially is a hole in your heart. And it was pretty substantial. So at that point, discussions began about repair. And I was 9 years old. July 17th of 1989, we decided to, well, my mom and my family decided that surgical repair was going to be the best route to prolong my life. The doctor helped in that decision making because my mother didn't want to submit me to open heart surgery at 9 years old in the 80s. But it all worked out fine because here I am. So they planned the surgery, and when they were in there, they also found an ascending aortic aneurysm. And so the way they treated both conditions was they patched the atrial septal defect, and they used a graft to wrap around my ascending aorta at the time. The surgery was successful. There wasn't any complications. And off I went to recovery. Recovery was terrible. I remember it. But I still, once I moved from ICU down to the regular floor, I still enjoyed, grandma sneaking me in fried chicken legs and donuts and all kinds of things that she wasn't supposed to be doing, but it made me happy. And so my family, broke a little rules here and there. The worst part of recovery was walking and going to the bathroom and that kind of thing. But as a child, I bounced right back. So we recovered from that, and we moved on with regular checkups, of course. But on we went with life. And for the beginning of my high school year, my mom moved us to Florida to start high school there. So we were living in New York. I had the surgery at Mount Sinai Hospital in New York. And then we moved to Florida when I was 13. Sorry. When I was 12, I actually forgot to say I had dislocated lenses in my eyes, which is what the ophthalmologist found when I was 3 years old. And so when I was 12, the decision to remove those lenses was made. And it's basically like cataract surgery, but they didn't place replacement lenses in. Because my eye was still developing and I was still young and whatnot. So they could remove the lenses so that they could better correct my vision with glasses. or with contact lenses at that time, because I did wear glasses up until that point, which were very thick, and the children were very cruel. But, we moved on from that, and we moved on to contacts, and I was really excited. Yay, I get to wear contact lenses and get rid of these glasses. And God bless my mom, because I lost so many pairs of glasses, and she had to replace them, and they were so expensive because the prescription was so high. And then I moved on to contacts, and I was, 12 or 13, trying to learn how to maintain contact lenses and, keep them clean and not lose them and whatnot. And I don't know how many I dropped down the sink and how many, I lost. And, here we go, having to replace now contact lenses, which were just as expensive or more expensive than glasses, I think. So my poor mother. But anyways, yes, I was very irresponsible. I was a kid with my contact lenses. And so when I recovered from that surgery, we went through a lot of contact lenses. But we moved to Florida. I began high school, and everything was going really well throughout my entire stint at high school. I didn't have any incidences or anything, so that was good. And then my senior year, I was 17, and I had 4 wisdom teeth and 2 baby teeth in my mouth that were just ready to go. They needed to go. And so some people with Marfan syndrome experience overcrowding of the teeth in their mouth, and so that was what I was experiencing. Basically, I had more teeth than my mouth had room for. So I had to have oral surgery and remove all 4 of the wisdom teeth and 2 baby teeth at once. So that was when I was 18, and then graduated high school. Everything was going well. When I was 21, I think, or 22, I had my first lens implant surgery in my eye. We could only do one eye at a time because they didn't want you to be visually impaired from the surgery with both eyes. So we did the first eye, and that went really well. So I didn't have to wear a lens in that eye. So now I just had one contact lens in one eye. And then about 2 years later, we did the other eye, and that went really well. So we didn't have any contact lenses at that point in time. I thought, yay, my eyes are cured. I don't have to worry about it ever again. And I didn't for a while. So that went really well. And then fast forward to adultish kind of life, and my career ended up bringing me to the DC area, and that started off really well. And one year I decided I wanted to switch my insurance to make sure I had top of the line insurance, because I was starting to explore options for genetic testing, because I knew that I was diagnosed with Marfan syndrome in the clinic, but I wanted a definitive diagnosis if I was pursuing in the future the possibility of being a parent. And so I changed my insurance because I wanted to make sure that genetic testing would be covered. And that year, actually shortly after my new insurance was active, I had this weird growth or lump or just fullness in my neck, in the side of my neck. And so because of my history with vascular problems, everyone was telling me you should get that checked out. You don't want to, take any chances. And it was right in the jugular carotid area. So I went to the emergency room and told them that I was experiencing just this fullness in my neck, and I didn't have any pain or anything like that. But it was just concerning because it was really just kind of protruding out of my neck. So the physician at the emergency room said, okay, we're going to do a neck CT to look at your carotid and your jugular. And I said, okay, that sounds like a plan. And so initially, she was just going to do the CT on the neck. But because of my history with vasculature. She thought she would go ahead and do neck and just a portion of the thorax, the chest, just so that she could follow the the jugular and the carotid artery down into the thoracic region, to make sure that there's no abnormalities with both of those vessels. And I'm glad she did, because if she didn't, we wouldn't have found these new aneurysms. So when she comes back to let me know what the results were of the CAT scan, she says, you have 2 aneurysms in your chest. And my immediate reply to her was, yeah, I know. I gave her this look like I had surgery. I know. And she goes, oh, you know? And I said, yes, I know. And she says, okay, well, we're going to have to call the thoracic surgeon and get you referred over there to start, monitoring you and managing this condition. And so I said, sure, okay, that's fine. And so she went off to work on the referral, and I sat there for a little bit and I thought about it, and it finally hit me. Wait a minute, what did she just say? Did she just say that I have 2 new aneurysms? And then it's just like, whoa. I couldn't believe it. When she was first telling me about it, I just thought, yes, I have an aneurysm. It was repaired. So anyway, now we're facing 2 new aneurysms, and the whirlwind began of referrals and surgeons. And I was immediately referred to someone locally and went to see this person, and they put my images up on this big screen in this conference room, and it was just so overwhelming, first to just be going through it, but then also to see it on the big screen, and they show you, well, here's normal, and then you can see this big ballooning, which is what an aneurysm is. It's a ballooning of the vessel, and you see this big ballooning on the big screen of your vessel, and you're like, uh-oh, I'm in trouble. So it was a lot for me to take in. I had a rough time with it initially, which is to be expected. But the key is to not stay in that moment, is to go through the emotions and feel everything you need to feel to process it, but then get yourself out of it, and it can take a different amount of time for different people. Take the time that you need. Just make sure that you move on from that and that you try to find a healthy way to deal with it. So anyway, I digress. So I saw it on the big screen and I was freaking out, and he was talking to me about a specific procedure, but then he culminated by saying, I wouldn't even feel comfortable doing this procedure with your history, so I want to refer you out myself to Johns Hopkins. And he referred me to Dr. Duke Cameron at Johns Hopkins, who is a pioneer in this type of procedure, and who this thoracic surgeon actually learned from. So I began going up to Johns Hopkins, and we still were unsure as to how soon this other procedure was going to be happening. Initially, we thought it was going to happen like right away, the way everybody was reacting and all the running around everybody was doing. But it turns out that after a few measurements and just monitoring it for a little bit, it was changing very slowly. And so the threshold for surgery is 5 centimeters. And when I was first diagnosed, I was 4.3 centimeters. And today I'm 4.7 centimeters. And so it's been a slow progression, but it has been progressing. And one of the things that, one of the ways they want to treat it is to replace the entire aorta. So the 2 aneurysms that I have, one is beyond the grafting, and I think we are suspicious that that is why I developed another aneurysm, is because the graft that was put in when I was 9 kept the ascending portion of my aorta the size of a 9-year-old. And so the remaining portion of my aorta grew as I grew into an adult. And so those two different size tubes, the smaller tube pushing blood into the larger tube, I think it was causing a higher injection fraction or whatever the scientific terminology is for that, and was weakening the walls beyond the ascending aorta. So the aneurysm lies in my aortic arch and a portion of my descending aorta. And I also have a aneurysm in the subclavian artery. So the plan is to remove the ascending aorta that is currently wrapped along with the arch and replace the whole thing with a synthetic material that essentially is going to be like bionic aorta. So the body won't recognize it as foreign. So I won't need to be on any anti-rejection medication, and it doesn't form any clots or anything like that. So I don't think I'll be needing to be put on any blood thinners, which is all good. And so if I can make it through recovery and surgery, which I know I will, I don't have to worry about that portion of my aorta anymore. So that is wonderful, especially for someone with Marfan syndrome. So today, my measurement is 4.7 centimeters, and rather than continuing to wait until we reach 5, we are already planning surgery for this year. And there's multi-factors that come into play as to why we're going now and not waiting until we're at 5. But I feel strong and I feel confident, and I'm going to have this surgery again anyway. So I say let's get it done, And so now we're beginning the process of just researching everything and making sure insurance wise and my family coming to care for me and all those different things, everything needs to kind of fall in place before we move forward. So that's the planning stage. And then right after I was diagnosed with the 2 aneurysms, my eye started giving me problems. So I experienced a retinal detachment. I'm not entirely sure how. I had an injury at work to the eye that dislocated my lens, and then it just kind of snowballed from there. So then I went in for a checkup for my lens, and it turns out that I detached my retina in that eye. So that became an emergency, and I had to go to surgery with that right away before I lost my sight in that eye. And they did this terrible procedure, and I'm sure other people have had it and have done well with it, but it just did not do well with me. And they did this procedure called a buccal placement, and basically what that means is they put this silicone band around your eyeball, and it collapses your eyeball enough so that your retina can reattach itself. Sounds so terrible, and let me tell you, I had the worst experience with that for 6 weeks. I couldn't leave my house, I couldn't drive, I couldn't look at anything with light, even just the TV being on, like that was just too much light. I was super photosensitive. At one of my checkups, my doctor tested my pressure in my eye, and it was enormously high. So much so that they had to do a procedure in the office where they numbed my eye and put a needle in it to drain the excess fluid so that it would bring the pressure down. And you're awake and they're sticking a needle in your eye. It was so creepy. I mean, I didn't feel it, but I was just like, oh my God, there's a needle in my eye, and I see it now, anyway. Even with that procedure, the pressures still continued to be a problem in my eye. And so what ended up happening was that the drainage system of the eye scarred down, most likely due to the buccal placement. And I lost the ability to control my ocular pressures myself, and drops weren't helping. So we had to go back in and have another surgical procedure so that they could put a ocular shunt, or a glaucoma stent in my eye. And basically what that is a little piece of silicone that they suture to the top back part of your eye. And it has a little straw that comes off of it, and that straw goes into your eye. And so when your pressures build up too much, the straw is supposed to siphon up the excess fluid, tears, or whatever you want to call that, to the back part of your eye. And then once it reaches back there, it gets reabsorbed by the body. Sounds well and good. And I was afraid to have another procedure with another foreign body in there because of my experience the time with the buckle. But actually that went really well, and I recovered really well from that. I had that procedure at Hopkins as well. The problem is the shunt isn't working as well as everyone thought it was going to work. So I still had problems with the pressures in my eye. So now I still have the shunt in my eye, but I'm on drops on top of that to control my pressures. And that's been a journey too, because I was reacting to the preservatives in some of the drops. And so now I'm on preservative-free medications, and it seems to be working, but we're making several trips to the glaucoma specialist over and over again. So yeah, so that's the most recent surgery before my next open heart procedure. And you know, I've gone through a lot. Like I said, I've had some challenges, but I seriously can't complain. You know, there are many different manifestations of Marfan syndrome. Some people have cardiac heavy manifestations. Some people have both cardiac and musculoskeletal issues. You know, I've seen children with Marfan syndrome that have rods placed in their spine, that have had to go through correction surgery for abnormalities in the sternum, because we tend to form either the sternum sticks out like a pigeon chest or it concaves inward. And then those kids that have severe forms of those deformities can experience problems with their lungs and their heart and that type of thing. And so they have to undergo procedures to correct that and have hardware and, you know, those type of things put into the sternum. And you know, it wasn't until my first Marfan syndrome conference where I got to sit with some of these kids and listen to their stories, and I was just blown away. You know, yeah, I had open heart surgery, but it was like one and done, and I moved on. You know, so there are people who are constantly struggling. And yes, I have my struggles. It's Marfan Syndrome Awareness Month, but for everyone with Marfan syndrome, it's Marfan syndrome awareness every day, because we are very much aware of all of the ailments brought on by this condition. So I am just grateful for the good times that I do have and the good moments that I do have. And you know, when I do face more challenges, I just try to find a way to get through it, you know, and come out on the other side. And don't let it rob me of my joy, and don't let it snuff out the light inside of me, because, you know, life is good. Life is very good. And so there's still so much more I want to experience, and I just hope that I can, you know, be some kind of inspiration to somebody. But also, I don't see myself as, you know, how do I put this? A charity case? I don't even want to put it like that, but I just don't see myself as a person who has issues. And I should, because I've already, you know, had heart surgery and I'm going at it again and whatnot. But I feel like a normal person. And I think that's important, you know, to just try to go on with life and try to enjoy the beauties of life and, you know, try to maintain your joy. And for a moment there, you know, when I was first diagnosed, I was thinking, oh man, I'm going to have to go see somebody. I'm going to have to be put on like Prozac or something. I've never experienced anxiety, before this, and I certainly experienced it once they diagnosed me. And boy, I tell you, it was something else. Like fear of falling asleep, or when your body finally just gives in and actually falls asleep, and you just startle awake, and you just have this feeling of panic all the time. And that was rough. That was a good 3 months or so that I went through that. But I'm so thankful that it was only 3 months. It could be so much worse, and I could have had to seek medical intervention, and it's okay if I would have. And I think about it now, and I'm, kicking myself for not taking advantage of that, because I never did. But um, if you need additional help, to get through something, there's no shame in that. There, it's there for utilization, and so everything in moderation, of course. But I was borderline there, and I didn't quite make it. And I came out on the other side, with a different perspective. And I just see everything a little differently, actually a lot differently than I have seen, or how I used to look at things before, and things that are just so petty that used to matter to me before just don't matter to me anymore. The things that matter to me now are, love and family. And I know it sounds cheesy, but it's so true. And I just don't want to waste my time um, on petty little things anymore. I want to do something inspirational with my life, and I want to serve my community. Um, those are the things that I feel are important now. So life is so precious, and we should take advantage of every part of it. So anyway, that is my story. Marfan syndrome does not define me as a person. A lot of people are surprised to hear that I have Marfan syndrome, because there is a physical characteristic that goes along with it, and I do have some, but not all. And sometimes even people from the Marfan syndrome community, look at me and they say, "Well, you don't have Marfan." But I was genetically tested, and yes, I do. So, and it's not, it's just a confirmation, and it is just going to help me better manage this as I go through life, moving forward. So, thank you for listening to my story. Happy Marfan Syndrome Awareness Month, as happy as it can be. I mean, I think it's just happy because we're spreading the word, and a lot more research is being done. And one day soon, we're going to see drastic improvements in managing this disease, and maybe even a cure. But I know the quality of life of people born with this is most certainly improving, and longevity. People with Marfan syndrome are living longer, so it's promising. The future is promising. So thank you for listening to me, and sorry if I was all over the place. And I hope everyone enjoys the rest of their day and week and month and year and life. And we will see you soon. Take care now.